how do families react to changing their diagnosis?
Changing the diagnosis for vascular anomalies is quite common. Uh, One of the studies done at the Vascular Anomaly Center at Children's Hospital reviewed several thousands of patients referred from within the United States to the center here. They found that more than 50% of these patients were either incorrectly or improperly diagnosed, which means that the patients referred from well-known centers to us, half of them are not properly diagnosed. The prevalence of misdiagnosis in international patients is much higher. The response by families most of the time to changing the diagnosis is just inquiring about the new diagnosis, but occasionally there are emotional parts of the process, which means that the child who could be like a teenager has been treated and diagnosed and lived all his or her life, let's say for 15 years, with the wrong diagnosis or a different diagnosis that may require now a different way of managing it. This certainly can bring some of the difficult emotional reactions that families often tend to express early in the interview process. To avoid this, we typically go through a longer introduction than we typically do with simpler diagnoses. The introduction sometimes focuses on the way to manage the disease rather than just getting stuck to the name or just the improper diagnosis that they were given.
I think it varies. I would say some patients are appreciative and kind of have a little bit of a sigh of relief and feel like they're finally getting the information that kind of makes sense with the symptoms that they have. So I think some people are very happy and very relieved. I think kind of a little more commonly when people, especially if they're teenagers or a little bit older and have kind of owned the diagnosis as they've been little, and their parents have kind of really owned that diagnosis as well, I think that sometimes there can be a little bit of shock or some disbelief or even some anger. Especially if they've been tied to the social media community with blogs, or if they're part of a specific support group, and they've really started to like build a community that's kind of helped them kind of, through some difficult times or procedures that they've had when they've been little. So to kind of shift that all away, I think can be isolating and, a little shocking sometimes to patients. But we encourage them to, really kind of, think about their symptoms, the communities that are work best for them as far as help, and to just stay connected to a center and support groups, so that they have that emotional help too. I think that's one of the pieces that's the hardest for us, is that, we have to make sure that we're also taking care of people emotionally, and so we don't want to kind of break any ties that are helping that down the road. So, vascular anomalies still can help each other, even if it's not the specific diagnosis that they thought that they